In the field of primary care, a multidisciplinary approach is carried out, involving all the professionals of the healthcare center. The goal is to provide care to the patient, the family, the caregivers, and all the individuals who support them in their daily lives. The daily activities of primary care nurses include diagnostic activities, identifying health problems, promoting health and preventing disease, therapeutic activities, administering various therapies, follow-up activities, monitoring and evaluating acute and chronic conditions, health promotion and disease prevention activities, developing initiatives to promote health and prevent disease. In the nursing consultation, nurses organize the day's appointment using scheduling systems. These appointments are classified as on-demand consultations, usually requested by the patient, preferably through a prior appointment. A scheduled consultation. The nurses arranges and agrees on a prior appointment with the patient. The goal is to carry out follow-up, detect self-care issues, or assess patients who have been recently discharged from a hospital. Demand management consultation. Requested by the patient for urgent reasons, the nurse assesses the patient and, after appropriate interventions, decides whether referral to the primary care physician is necessary, whether a follow-up appointment should be scheduled, or whether the patient can return home with a set of nurse-prescribed care instructions. This framework also includes scheduling appointments for laboratory tests, such as blood draws or the collation of various types of samples. The autonomous work carried out by nurses in primary care is guided by the portfolio of services. Each activity or assessment performed by the nurse must be recorded in the electronic clinical records using care protocols. These care protocols include a series of specific activities that nursing students must understand and carry out as part of their clinical practicum. These activities include prevention and promotion of individual and family health, care for prevalent health problems, complementary health care services. Within individual and family health promotion and disease prevention activities, prevention plans targeting the most prevalent health problems among adults are especially important. To monitor and reduce cardiovascular risk factors, activities are carried out such as completing specific assessment scales, measuring vital signs, evaluating and supporting adherence to prescribed treatments, and providing hygiene and dietary recommendations. Annual and seasonal vaccination campaigns, along with the monitoring of the adult immunization schedule, complement efforts to prevent certain infectious diseases and their complications. The primary care nurse also carries out group-based health promotion activities through various health education programs. For example, adolescent-focused programs address topics such as nutrition, sexual and emotional education, first aid, and drug use prevention. These programs are delivered in the educational centers within the basic health area. Health centers also implement all the programs included in their portfolio of services, such as community-based smoking cessation interventions or active patient programs for diabetes management. Care for prevalent health problems includes the management of patients with diabetes, hypertension, chronic obstructive pulmonary disease, or multiple chronic conditions, among others. Patients with diabetes receive specific interventions aimed at preventing and managing complications associated with the disease. Some of these interventions include proper food examination, use of the monofilament, assessment of arterial pulses, referral for retinal imaging, electrocardiograms, anthropometric measurements, and educational programs to promote health and detect complications. The management and follow-up of patients with multiple chronic conditions involve specific activities aimed at assessing and supporting both the patient and their immediate support network. In these cases, a home visit is carried out twice a year, one of which is conducted jointly with the primary care physician. During these visits, the patient, their living conditions, and social environment are evaluated. It is essential to complete the care protocols using validated tests and assessments scales. All of this documentation provides valuable information for a comprehensive evaluation of the patient's overall condition. Other interventions are also carried out during nursing consultations. Some of these include measuring vital signs in high-risk patients or those with recent changes in their regular medication, monitoring weight and blood glucose levels to identify risk factors, assessment and management of skin lesions, follow-up of patients after a hospital discharge, follow-up of anticoagulated patients. Within the portfolio of services offered in primary care nurse consultations, additional complementary services are provided. Some of these include minor surgery, involving the removal of benign lesions in coordination with the female physician, and cryotherapy, which is independently performed by the nurse. Team meetings are held in health centers to ensure effective management. Clinical sessions are also delivered by members of the primary care team as part of ongoing training and updates on various relevant health topics. Students will learn to carry out all the functions required by the future profession, always under the supervision of a registered nurse. The primary care rotation is designed to help students gain greater independence, decision-making skills, and confidence in their own abilities and knowledge. In addition to practical training, they will participate in a series of seminars that promote collaborative learning, focused on the specific competencies of primary care centers. Student evaluation during clinical placements includes the use of a rubric to assess the level of autonomy demonstrated in the development of both general and specific competencies and skills. Seminars and the learning portfolio are also assessed. This entire process is organized, supervised, and evaluated by associate faculty members in health science. It aims to assess progress in the acquisition of competencies based on the previously planned learning objectives.